Food prep for the sick. In today's video, we will tackle two illnesses being stroke and colon cancer, as well as food prepping for one of our interviewed patients to their needs given their condition. So first we're going to start with what is our first disease. So first we're going to go with colon cancer. So what is colon cancer? So colon cancer, aka colorectal cancer, is a disease in which cells in the colon or rectum grow out of control. Sometimes it is called colon cancer for short. The colon is the large intestine or large bowel. The rectum is the passageway that connects the colon to the anus. So in colorectal cancer, aka colon cancer, so there are 5 primary stages to colon cancer. Stage 0, Stage 1, Stage 2, and Stage 3, and then all the way to Stage 4. So now the signs and symptoms of colon cancer is going to be bowel habits are going to be changed. Maroon colored or black stool, rectal bleeding, abdominal discomfort, not emptying your bowels completely, abdomen fullness feeling, fatigue, and weight loss, which is the case for our patient, which we're going to be reading today. The causes for colorectal cancer can be anyone over the age of 50, anyone in the family with the history of colorectal cancer, inflammatory bowel disease, obesity, and then like some other external factors like lack of exercise, smoking, alcohol use, a diet of high in red and processed meats. Some remedies for this is having diet and exercise, having a healthy lifestyle, drinking lots of water, avoiding alcohol, and having timely screenings after the age of 50. So the recommended diet for colon cancer, we'll have patients that go under this condition have to eat foods that are not hard to digest, meaning have them eat softer foods if they cannot defecate, as well as having low fiber, as to not strain their colon. This diet will consist of carbs, proteins, fats like a normal person but modified for his condition, yogurt, fish, white rice, avocado, etc. So here is our patient. He was interviewed online but opted to not show his face for privacy reasons. Our patient is Marcelito Gonzalez, age 55, diagnosis of colon cancer stage 4, and a diet prescribed by the physician is eat healthy foods that are high in proteins and vitamins. His vital signs are 37.5 degrees Celsius, blood pressures 130 over 80, heart rate 78 BPM, and respiratory rate of 18 CPM. So to sum up the history of his present illness, this is a modifiable disease since he himself was having a lifestyle of eating too much processed foods. So it came to him when he defecated 1 to 2 weeks before hospitalization that there was blood in his stool and had a lot of lower abdominal pain. The patient proceeded to visit the hospital for a checkup, and when he got checked up, he was screened for stage 4 of colon cancer. He had intermittent bilateral lower abdominal pain, and he has also been feeling more tired and believe he has lost some weight. All signs and symptoms of colon cancer as stated before. So his current occupation, since he is on stage 4, he is not under any occupation but is supported by his kids. His activity is level 20, with activities being home chores. Here's the following calculations for our colon cancer patient, as well as their meal plan. Now we will be moving on to our stroke patient. First, what is a stroke? So, a stroke, sometimes called a brain attack, occurs when something blocks blood supply to the part of the brain or when a blood vessel in the brain bursts. In either case, parts of the brain have become damaged or died. A stroke can cause lasting brain damage, long-term disability, or even death. There are different kinds of strokes. You can have a blood clot in the artery or sometimes even having a diseased carotid artery where it's inflamed by having plaque buildup in the arteries where it's difficult for the blood to flow, also causing a stroke. So remembering stroke is caused by sudden loss of blood flow to the brain, they're all related in that way. So how do you spot a stroke? We have the FAST method, which is looking at their face. If one side is drooping, that is also a sign. Arms, having weaknesses to any of the limbs, that's also another sign. Speech, if they have a difficult time speaking, like slurring their speeches or having stutters, that's a sign. And time. Whenever you spot a stroke, it is important that every second counts and you call for emergency help as fast as possible. The common causes of stroke are having high blood pressure, high cholesterol, diabetes, smoking, alcohol, and a sedentary lifestyle. Basically anything that can block your arteries and inhibiting blood flow to your brain. So physicians recommended eating after a stroke, having foods that reduce damage to blood vessels and foods that contain potassium and can help control blood pressure. So ideally, fruits and vegetables that contain antioxidants. And also having high fiber can lower cholesterol, as well as folate, which is found in green leafy vegetables, may reduce the risk of stroke. Whole grains and cereals that contain high fiber and folate can also work. Dairy foods are another source of potassium along with calcium that can help control blood pressure. Alternatives to dairy can include calcium-enriched soy and rice milks, but also other sources of calcium include fish with bones, almonds, and tofu. Eating to prevent a stroke is just simply eating healthy food that reduces your blood pressure and also reduces your cholesterol. After you had a stroke, limit how much salt, sugar, saturated fats, and alcohol you get. These will further increase your risk of future strokes, so be aware of that. Now we move on to our patient. So our patient, Mr. George W. Hall, also interviewed online, lives in the United States. He is age 29 as of current. His diagnosis was an overdose stroke. The diet prescribed by the physician are whole grains, fruits and veg with antioxidants, dairy with potassium and calcium. Mr. George Hall was also kind enough to give us his current diet plan after he had the stroke on screen now. So the vital signs for our patient. So during the stroke, our patient's vital signs were all normal except his temperature, which increased heavily like he was in a fever. So during stroke, he had 39 degrees Celsius. Normal levels now, it's at 36.6 degrees Celsius. His blood pressure is 108/75, normal. Heart rate is 75 BPM, and respiratory rate at 15 CPM. In summary, George Hall was doing recreational use of marijuana, but his marijuana had been spiked with heroin. The heroin was overdosed. Therefore, when he smoked the marijuana, he had an overdose, which led to him seizing up and then having a stroke since it blocked his arteries from functioning. He was admitted to the hospital, which he recovered in 2 days. In the present day, now he has a slight numbness on the left side of his nose and cheek with no other side effects. This case was modifiable since it was caused by a sudden overdose of drugs and not any underlying causes when he was born. So here's George Hall's current occupation, which is a delivery driver. He has a very high activity level, being gym workouts and active in sports, as well as his occupation. So we're giving him a level 40 in activity level. Here on screen is the calculations for his calorie intake and macronutrient needs, as well as on screen will be his diet plan. So we chose George Hall's diet plan for our project, so here is some footage of us preparing his meal for him. Along with presenting it live to our teacher the day we prepared it. The information you're watching now is the same information we presented on the day we prepared the meals. Thank you again for watching.